This video summarizes the study titled Incidence Rate of Cardiovascular Disease Endpoints in the National Aeronautics and Space Administration Astronaut Corps. Exposure to microgravity, which occurs during spaceflight, is known to cause acute changes in cardiovascular function and has become a primary concern of physiologists concerned with astronaut health. However, despite the well-established detrimental effects of spaceflight on cardiovascular health, it is unknown whether the astronaut occupation or exposure to microgravity influences the risk of long-term cardiovascular disease. This longitudinal study included data from 210 NASA astronauts and 981 non-astronaut NASA employees. Non-astronauts were matched with the astronauts on age, sex, and body mass index to evaluate acute and chronic morbidity and mortality. An additional comparison was made between astronauts with and without spaceflight experience. Primary outcomes included composites of clinical cardiovascular disease endpoints like myocardial infarction, congestive heart failure, stroke, and coronary artery bypass surgery. 5.2% of the astronauts had a clinical cardiovascular disease endpoint, and 2.9% had a coronary artery disease endpoint. Conversely, 4.7% and 3.1% of the non-astronauts had a cardiovascular disease or coronary artery disease endpoint, respectively. There were no between-group significant differences in the risk of developing a coronary artery or cardiovascular disease endpoint. In astronauts with spaceflight experience, the risk of cardiovascular disease and coronary artery disease was not different when compared with non-astronauts or astronauts without spaceflight experience. These findings suggest that the astronaut lifestyle is not associated with an increased long-term risk of cardiovascular disease development. Thus, this investigation has important implications for the lifelong assessment of astronaut health, and suggests that individuals in the astronaut corps are not at an increased risk of developing cardiovascular disease. However, the impacts of long-duration missions, or those with greater exposure to cosmic radiation, on cardiovascular disease risks merits further investigation.